Hi, I'm Dr. Elizabeth Hale, and I'm a dermatologist in New York City. I'm in practice with my sister, Dr. Julie Karen, who's also a board-certified dermatologist. We are both on faculty at the NYU Langone Health Medical Center, where we teach NYU residents dermatology. And in addition to teaching at NYU, we started a private practice in Manhattan about 6 years ago. Both of us did residencies in dermatology, followed by fellowships in skin cancer and laser surgery. So while we are dermatologists, most of our practice specializes in the detection and treatment of skin cancers, as well as in the treatment of sun damage, otherwise known as photoaging. And as you might imagine, many of the same patients have the same conditions in that someone who might come in for skin cancer also has signs of sun damage and might be interested in getting rid of some brown spots or some wrinkles or sun damage. Similarly, someone might come in with more of a cosmetic concern, and we insist everyone have a full body check. And we find that many patients who come in for more cosmetic treatment of sun damage also may have skin cancer. And as many of you know, skin cancer is the most common cancer, and it's really very important to be aware that early detection makes a big difference. So today, Dr. Karen and I will be talking to you about the importance of protecting your skin, about the use of very good sun protective habits and behaviors, and why it's important to see a dermatologist for a full body skin examination, because when it's detected early, skin cancer is almost always curable. So we want to try to help and educate you and talk today. So I'm going to talk first about sun damage, and then we'll segue into Dr. Karen's talk, which relates to diagnosis and skin cancer. So when we talk about sun damage, the medical term for this is photoaging, which is basically aging of the skin induced by the sun. We know that up to 90% of skin cancers are associated with overexposure to ultraviolet radiation from the sun. But what some people don't realize is that up to 90% of the visible changes on the skin, which are commonly attributed to premature aging, are also caused by unprotected sun exposure. So as I mentioned, there is a lot of overlap because unprotected sun exposure can cause both skin cancer and also more of the visible signs of premature skin aging. So when we talk about the visible signs of photoaging or sun damage, these are patients that we see in our office on a daily basis. People may come in because they've noticed the development of brown spots, most notably on the face, the back of the hands, the chest, because these are areas that are exposed year-round, not just in the summertime, which we'll talk about. They also might comment on a different appearance to their skin, whether it's fine lines and wrinkles, or even a coarseness or leathery texture, enlarged pores. These are all signs of unprotected sun exposure and chronic cumulative sun damage. When we look at what my sister and I treat on a daily basis in our practice, some of the treatments we do are more medical. We are both Mohs surgeons, so we do Mohs surgery as well as other excisions for skin cancers and precancerous lesions. We use some topical forms of chemotherapy for precancerous lesions. We also do perform a bunch of aesthetic treatments in our practice, which are more cosmetic. But as you can see, there is great overlap because many of the procedures and the patients we treat do have an overlap of both medical and aesthetic signs of photodamage. Again, in the name of skin cancer and precancers, brown spots and wrinkles, and then of course there's great overlap in the middle. And I'm gonna focus right here on SPF, which is the top of this list, because we do believe it is the single most important thing to do to slow down the signs of skin aging and to help minimize your chances for sun damage and skin cancer. So when we talk about ultraviolet radiation, it's important to know that about 10 years ago, it was upgraded to the highest cancer risk category, joining arsenic and mustard gas. Believe it or not, ultraviolet radiation is linked to more cancers worldwide than any other carcinogen. And that actually includes the correlation between smoking and lung cancer. Recently, it was thought that smoking and lung cancer are definitely related, but that the effects of sun and the development of skin cancer is even more highly correlated. However, despite this, the rates of unprotected sun exposure remain high, despite the fact we know that it directly causes skin cancer. This is because people tend to really think that being out in the sun is healthy, there's a healthy tan, we try to educate our patients there's really no such thing as a healthy tan. While it is important to be outside and to get fresh air and exercise, it's really important to protect your skin while doing so and trying to avoid a burn or a tan in the first place. But I'm going to give you some background onto sun damage, and then we can talk about things you can do to protect yourselves. So we know that unprotected and overexposure to ultraviolet rays causes both acute changes and chronic changes in the skin. The acute changes are more inflammation, for example, sunburn, which we talk about erythema and edema, which basically is redness and swelling. And as we know, sunburns can be very painful because of all that inflammation. Some other changes are tanning and hyperpigmentation. But when we look at more of the chronic effects of unprotected overexposure to the sun, you can see more broader effects like immunosuppression. People don't often realize that, but that when you're out in the sun chronically, it can have an immunosuppressive effect on your immune system and actually cause other cancers and other things to come out more. A classic example might be a fever blister. That's a very common occurrence caused by a herpes simplex virus. And we know that when people are out in the sun without protection, their herpes simplex cold sore might be more likely to blossom. Similarly, patients that have had other types of immunosuppression, like transplant patients, when they go out in the sun, the effect of all that immunosuppression is magnified and they're at greater risk for developing skin cancer for many reasons. Also, some of the chronic effects include photoaging, like we talked about, which is sun damage, and photocarcinogenesis, which is the development of skin cancer. Here are two classic pictures. We're looking at the acute changes in the form of sunburn. And then this picture, which went around the media a couple years ago, this was a truck driver who spent his entire working years driving a truck, getting sun exposure through a window on the left side of his face, which you can see here. And it's no doubt that that left side of the face shows more coarseness and wrinkles and brown spots and likely precancers and skin cancerous lesions. Just to talk about the etiology of the acute versus the chronic sun damage, when we look at that sunburn, we're thinking, okay, she must have been at the beach. It must have been summertime. It must have been very warm and sunny. And that's when we look at sunscreens, we talk about ultraviolet B rays. And when you look at a sunscreen, and we call them SPF, but really SPF refers to the ability to block UVB, ultraviolet B rays. And you can remember B for burn. And that's why we wear sunscreens in the summertime when we're going to the beach. But what's really important to realize is ultraviolet A rays, UVA, those are the rays that are present year-round. So it's not just in the summertime when we go to the beach. Ultraviolet A rays penetrate through clouds, through windows. We see here in the truck driver, just being near a window on the left side of his face. Ultraviolet A rays are longer than ultraviolet B, and they penetrate year-round. And this is why, as dermatologists, we talk about the need for daily sunscreen. And in addition to an SPF number, which we'll get to, you want to look for broad spectrum protection, because that shows it blocks against ultraviolet A and ultraviolet B. So just a basic rule about skincare, because often patients come into our office and they want to get started on a skincare routine, and we talk about the basics. And it's really cleansing your face. Of course, we moisturize, but ultraviolet protection is something we talk about to our patients every single day. And again, we do that year-round. And that's because, as I mentioned, the ultraviolet A rays penetrate even in the winter, even in the fall, through windows. Even while we're at home in quarantine, ultraviolet A rays are penetrating and reaching our skin. But it's important to also realize, with increasing knowledge and some of these societal changes, like we're spending more time in front of our screens, and we're on Zoom calls all day, and we're on social media, we're working from home, we're looking at our devices. There's more interest now in skin at the molecular level, and some of those effects of the HEV, the blue light, the infrared radiation, these are emitted from our devices. And while we are not yet sure exactly what type of mutations are induced in the skin, there are new data that these sources of radiation are also contributing to sun damage, skin aging, and possibly skin cancer. So again, it's very important to look for a broad spectrum sunscreen that blocks UVA, UVB, and hopefully into that visible light, blue light spectrum. And just while we mention that, I want to mention for ingredients, because we get a lot of questions about that. Zinc oxide is a great ingredient that is very broad spectrum blocking potential. So that's definitely a good agent to look for. Furthermore, we talk about effects of pollution on the skin and certainly the environment. So we don't know exactly how that contributes, but we do know that there are free radicals generated in our skin from pollution. And this is why wearing a broad spectrum sunscreen, often paired with an antioxidant, can help to mitigate some of that damage and minimize the effects. So when we talk about sunscreens, the American Academy of Dermatology suggests that regardless of your skin type, that means whether how pale and fair-skinned you are, how dark-skinned, despite whatever your ethnicity may be, a broad-spectrum sunscreen with SPF of 30 or higher should be used year-round. And it's recommended for daily use because, as we discussed, sun protection is a principal means for preventing premature aging and development of skin cancer. Even on a cloudy day, 80% of the sun's ultraviolet rays pass through clouds. And sun also has high reflective powers. So when you're at the beach, about 17% of those sun rays reflect. But for those skiers out there, 80% reflect on snow. So it's very important to remember in the wintertime, and especially for the skiers out there, to wear sunscreen even in the winter. So what can you do to protect yourself? This is really important, and I think this is the take-home point of my lecture. Contrary to popular belief, only about 25% of a person's lifetime sun exposure is acquired before adulthood or age 18. People often come into the office and they say, but it's too late. I used to wear baby oil. I used to use reflectors. Isn't the damage already done? And yes, some of that damage during childhood has been done, but we know now it's really a cumulative, ongoing process. So it's never too late to start protecting yourself. There have actually been some very good studies out of New Zealand and Australia, where they looked at men and women in their 60s who started wearing sunscreen every day, as opposed to just when they went to the beach, and they followed them for 20 years. So it was a really longitudinal and prospective study. And those patients that started wearing sunscreen every day had less brown spots, less precancers, and less skin cancer. So even starting at age 60 and beyond makes a difference. These are now some more simple steps you can take, but they're important to be aware of. Avoid the peak hours of sunlight, generally 10 to 4, when sun's rays are strongest. Now we know that's not always realistic, but you certainly don't want to go out for your daily run at noon when the sunlight's strongest. Try to go early in the morning or later in the evening. Use a daily sunscreen of SPF 30 or higher. Wear sun protective clothing. My sister and I are a big fan of sun protective clothing for ourselves, and especially when it comes to our children, which brings me to number 4, you want to teach children about sun protection early. Because while we know that sun damage is a chronic, ongoing process, we do know that sun damage and sun burns during childhood directly increase your chance for melanoma later in life. And these are my 3 children, and really since a very young age, I taught them, and my sister has taught her children, about wearing a rash guard. So when we tell them to go put on a bathing suit, even my now teenage sons will go put on a rash guard top in addition to their bathing suit bottom. And we know that sun protective clothing can provide, and it should be a specific type of fabric, and it would say UPF on the label, ultraviolet protection factor, but they can afford ultraviolet protection of 50 or higher. And that's a nice level of insurance when your kids are swimming or at the beach all day. Instead of having to reapply every 2 hours, we have our kids and ourselves keep a rash guard on the whole time. You want to avoid tanning salons. So there is data that the new high pressure sun lamps emit doses of ultraviolet radiation that can be 12 times as powerful and as damaging as the sun. Furthermore, exposure to tanning beds before age 35 increases one's risk for melanoma by up to 75%. Tanning beds are considered and recognized a human carcinogen. So for my patients who still like to look tan or feel bronze, sunless tanners are definitely a safer option. I just remind you that if you decide to use one of those sunless tanners, they're safe to use, but they don't take the place of sunscreen. You still need to apply sunscreen on top of the sunless tan. So just one more word about the artificial tanning devices. Those too were upgraded by the World Health Organization and categorized as carcinogenic to human beings. In Europe, tanning is banned for individuals under age 18. In the United States, dermatologists are trying hard to legislate this. More than 35 states have imposed some sort of restrictions on minors, but it does vary considerably and it's not universally enforced. So we're really trying to help educate everyone, but particularly our teens and our youths, to stay out of tanning beds because they are definitely carcinogenic and increase the risk for melanoma, which, as you'll soon hear, is the most serious type of skin cancer, as you know. So again, we know the risk of melanoma is increased up to 75% if you start tanning before age 30. But recently there's been some information that the non-melanoma skin cancers like basal and squamous cell carcinoma also have an increased risk. Important to know that 71% of people who indoor tan are women aged 16 to 29. So we oftentimes focus our education in that age group as well. People often ask about vitamin D, which of course is a very important vitamin for many aspects of our health and our immune system and our bone health. But we feel that you can get your vitamin D through a healthy diet that may include vitamin D supplements, because unprotected sun exposure definitely leads to development of skin cancer, and there are other safer ways to get sufficient vitamin D. Number 7, you want to examine your skin regularly, and you'll hear in a moment from Dr. Karen about what to look for in your moles, but you certainly want to be familiar with your own spots and your own moles, because if something changes or if something's new, that could be an indicator of a skin cancer. And if you familiarize yourself and know what to look for, that can help make a diagnosis at an early stage. Thank you very much for your attention. I'm going to turn it over to Dr. Karen, who will talk about the diagnosis of skin cancer and what you can look for. But hopefully during quarantine and beyond, you'll protect your skin and use a broad spectrum sunscreen to help minimize the signs of sun damage and minimize your chances for developing skin cancer. Thank you.
Hi, so I'm Dr. Julie Karen, Dr. Hale's sister, and I'm going to speak a little bit about what you yourself can do to protect yourself and your partner, not from the damaging effects of UV radiation, but to how you can inspect yourselves to look for something that might be concerning, something that might warrant medical attention. And this is as important as ever. Yes, we are amidst quarantine. Yes, doctor visits have been limited. But nonetheless, you still have to be on the lookout for something that might be suspicious and that may need immediate medical attention. So just a little bit more sort of overview of skin cancer. You did hear some of this before, but it is important to recognize that skin cancer is far and away the most common form of cancer affecting people in this country. There's well over 5 million new cases that are diagnosed each year in the US, and probably that number is significantly rising and continuing to do so. There will be more new cases of skin cancer than of breast, prostate, lung, and colon cancer combined. Another startling statistic is that 1 in 5 Americans will develop some form of skin cancer at some point in their lifetime. When we speak of skin cancer, it's a heterogeneous group. The 3 most common types are basal cell, squamous cell, and we categorize those as non-melanoma skin cancer, and then melanoma. Basal cell carcinoma comprises the vast majority of skin cancer, accounting for about 80% of new diagnoses. About 16% are squamous cell carcinoma. Thank goodness, melanoma, which is far and away the most devastating and the most dangerous, accounts for only 4% of skin cancer diagnoses. However, although melanoma accounts for less than 5% of skin cancers, it is responsible for 80% of skin cancer-related deaths, and therefore should not be ignored. Malignant melanoma has an incidence that has been increasing dramatically over the past 5 decades. The lifetime risk of one developing melanoma in 1930 was about 1 in 2,500 Americans. And several years ago, in 2015, that number had increased to 1 in 50 Americans who may develop malignant melanoma over their lifetime. So how can you suspect that you may have melanoma or someone that you love may have melanoma? A mnemonic that has been widely popularized is called the ABCDEs of melanoma. And this is something that Dr. Hale and I spend a lot of time counseling our patients about day in and day out, as it is so critical as your first step to protecting yourself. So A stands for asymmetry. Whereas benign or banal, common nevi, generally are symmetrical, Most melanomas, especially early ones, demonstrate some asymmetry. That means if you were to draw a line down the center in any direction, you cannot fold it on itself and get a mirror image. The lesion demonstrates features on one side that are distinct and different from that on the other side. Now, it is important to note that there is a subtype of melanoma that may demonstrate symmetry. It's a less common subtype called nodular melanoma. So I will say that if you have a lesion that is symmetrical but is rapidly growing, changing, enlarging, or developing substance, please do not ignore it because of the absence of asymmetry. B stands for border irregularity. Common moles have smooth, round, regular borders that you can clearly use a pencil or other writing utensil to draw a mark around, usually a circle. Whereas atypical lesions, early melanomas, often have a more irregular or varied border. The border may be smudgy, it may be ill-defined, it often is jagged or scalloped, as you see in these images above. C stands for color variability. The vast majority of common nevi are a single shade, usually brown. They may be light brown, they may be dark brown, or somewhere in between. But most early melanomas, and certainly as melanomas progress, these lesions tend to demonstrate multiple shades of different colors. Within a single lesion, as you see in these two images, you may notice some light brown, some dark brown, some black, red, or even blue. So if you notice a lesion that has multiple colors within it, it's more heterogeneous, less homogeneous. This too could be a sign of melanoma. D, for many, many years, was believed to stand for diameter, and still many people do cite it as such. Now, it is important to know that not all melanomas have to be large, but as a general rule, if you have a lesion that is larger than 6 millimeters or a pencil eraser, you should pay extra close attention, as these lesions are more likely to turn into or possibly to be melanoma. But if you have a small lesion that is demonstrating some of the features that I just discussed, asymmetry, irregular borders, multiple colors, do not ignore it because it is smaller than a pencil eraser, but do pay closer attention to your moles that are larger. D also can be considered to stand for dark, and not all dark moles are melanoma, that is for sure. And certain skin types and ethnicities certainly make darker moles than those individuals who are very, very fair. But if someone has a lesion that is significantly darker than all the other lesions, or that abruptly becomes dark, this could be a sign of something that could be a melanoma. So here we see an example of melanomas that are not large at all. These are clearly smaller than 6 millimeters, but they are quite dark, especially in contrast to the background skin. And these were melanomas. So again, do not ignore small lesions which exhibit other concerning features. E, perhaps the most important of all, stands for evolution. If you are observing a lesion change, whether it's a new lesion that changes or a lesion that you've had for many, many years that starts to change, do not ignore that lesion. Please seek medical attention immediately. For recent change, it is likely the most important indication that a lesion has become atypical or could have turned into a melanoma. I'm going to say one more that we don't have a slide for because it's not classically part of the ABCDEs, which has been widely, as I said, disseminated. But I often do mention to my patients, if I were to add one more letter to the mnemonic, it would be F for funny looking. If you have a lesion that is an ugly duckling and it stands out in contrast to all your other moles, please, that also could be a melanoma and needs medical attention. So we tell patients that oftentimes people will make a certain signature mole. Most of their moles will look like one another. And should you ever develop a new mole that suddenly stands out as different from the rest, or a lesion that used to blend in but suddenly is standing out as an ugly duckling, please also get that checked out. So what are the individual risk factors for melanoma? Just to further review some of what we heard before, there certainly is an increased risk associated with fair skin, light hair, light eyes, and a personal or family history of melanoma. Again, we worry about sunburst exposure. So areas that are generally sun protected, that have had a few intense bursts of unprotected sun exposure, maybe a few bad sunburns as a kid. For this reason, we often do see melanomas on the lower legs of women, as these areas are generally protected. Same with the trunk or the upper back of men. These areas are often not exposed to the sun, but in the summertime, they do get intense, often unprotected sun exposure. Individuals that have numerous moles, whether they are banal or common appearing or atypical, are believed to have an increased risk of melanoma. And of course, the use of sun tanning devices unequivocally increases one's risk of melanoma. And these people should be extra careful and change the habits immediately if they have not already. So what can you do to protect yourself? Self-examination is critical. We strongly recommend an annual examination by a professional practitioner, such as a board-certified dermatologist, but a year is too long if something is changing on your skin between those visits. So we encourage every patient and their partners, their friends, their spouses, roommates to perform self-examination on one another. It's really very simple. What you need is a full-length mirror, a handheld mirror, ideally to assist the difficult to inspect areas, a monthly reminder, as we do, believe it or not, recommend that you do this every single month. And as I mentioned, having a partner is ideal, but by no means essential. The reason why we say every month is if you pick one day out of the month, maybe the first of the month or whatever date your birthday falls on, you'll get in the habit of doing it. And all it takes is a few seconds when you get out of the shower, before you get dressed, in the good lighting of the bathroom, to just look up and down your entire skin and look for lesions. Initially, everything will look funny to you. You'll start wondering, have I always had this lesion? Has it changed? And if you're concerned, sure, go get, seek care from a dermatologist. But you will get used to your moles, and that will be your first tool as defense. If you notice something changing, you want to bring it again to attention immediately. So here's just a useful sort of multi-step approach to the self-examination. You want to check the front and the back in a full-length mirror, and then you want to raise up your arms and turn side to side to look at both the right and left sides. Be sure not to forget to look under your arms, on the forearms, front and back, and on your hands. You also want to look at your legs and feet and between your fingers and your toes. The handheld mirror can really help you inspect the neck and the other difficult areas to see. And if you can, really try to spend some time inspecting your scalp, maybe using the aid of a hair dryer to push your hair out of the way, as you can get melanoma on the scalp as well. And then don't forget to look in areas, even those that you think haven't seen the sun, like the buttocks, and the handheld mirror can assist with this. If you have any spots about which you're concerned because they demonstrate any of the A, B, C, D, or E's, mark them down, call up your physician, and go get them checked out. These days with, personal handheld phones and otherwise, it is so easy to photo document these lesions. If you have any spots that I mentioned are slightly larger than a pencil eraser, take a picture, file them away in a secret, file on your phone so that you can return to them when you next look at them to look for any change. Again, you don't want to rely solely on self-examination. Getting professional advice is imperative, but this can be a useful adjunct to exams from your physician. So just a word about the unique environment that we're in right now, because I've mentioned many times, if you're concerned, call your doctor, call your dermatologist, go get checked. And for many people, the reality is that's simply not possible right now. It may be impossible for some people to go and get their skin checked because doctors' offices are closed or because they themselves are at risk due to underlying medical conditions. So I do want to just mention a tool that I have found extremely useful in these past 2 uncertain months. Dermtech is a company that came up with a pigmented lesion assay that helps you to non-invasively assess moles. Utilizing tape that's affixed to a lesion, the tape is then stripped off and it's processed for the presence of RNA that indicates that certain genes associated with melanoma are or are not being expressed in the lesion. So this is called precision or genomic testing, and it really can help to diagnose melanoma without cutting a lesion, by examining the entirety of a lesion, and in a non-invasive way. And a few months ago, this could only be performed in doctors' offices, and that really is where it is best performed. But during these unique and uncertain times, Dermtech has partnered with physicians such as myself to be able to offer this to patients who cannot get their lesions inspected. So if you have a concerning mole, don't think, oh, there's no way I could get in right now. There are options, and there are physicians who can help partner with you to get this test, this non-invasive test, sent to your home and performed so that it can be inspected and categorized as suspicious for melanoma or less suspicious for melanoma, in which case your doctor would just want to monitor the lesion. So just something to think about in the back of your mind. But just to review, I cannot stress enough how important it is during this time, not just to protect yourself, as you heard my sister, speak in great detail about, but also to inspect yourself and inspect your loved ones. And don't ignore any lesions that concern you. It really can save your life. Thank you for your attention.
Hi, so this is Dr. Hale, and Dr. Karen is joining us as well. So we've already received several questions, and we're going to answer those now. The first question we received is, how often do you recommend getting your skin checked? So unlike other types of cancers, there are no formal recommendations, but as dermatologists, we believe that every adult, so everyone over the age of 18, should have an annual skin check. So that's once a year. But if you yourself or one of your first-degree relatives have already had melanoma, you should get checked every 6 months. And if you've had other types of skin cancer, we also recommend getting checked every 6 months. Furthermore, if you have specific risk factors, for example, you should be honest with your dermatologist. And if you did use tanning beds when you were younger, even if now you don't use tanning beds and now you know that they're not healthy, but if you use them in the past, that does put you at higher risk for melanoma. If you maybe got a lot of sunburns as a child, and specifically if you have a lot of atypical moles or dysplastic nevi, you should also get checked every 6 months. Also, if you've been newly diagnosed with melanoma, we recommend getting a full skin examination every 3 months for the first 2 years after diagnosis, and then every 6 months thereafter. So the general take home is once a year at a bare minimum, but if you've either had skin cancer or you have specific risk factors, it would be more frequently than that. But just to remind everyone, if you do note a mole is changing, you don't want to wait for your next skin examination. You should call your dermatologist and tell them that you have a new or changing or suspicious mole, and you should try to see them as soon as possible. Because as we mentioned, when it is detected early, skin cancer is almost always curable.
The next question that we received sort of dovetails nicely with this. And the question is, what should you do if you identify a concerning spot? And specifically, in light of social distancing and many office closures that many doctors' practices are currently encountering. So do not delay. If you notice a suspicious spot, even if you feel that you are stuck at home and you cannot get to the doctor, please do reach out to your dermatologist. If you don't have a dermatologist, there are several resources online that you can find one. And once you have one, you want to call and say specifically that you have in fact noticed a concerning spot. This can save your life, because if you notice something, there's 2 options that might then happen. One option is certain offices are seeing urgent patients. So skin cancer is a medical condition, and our office, for example, is open 2 days a week to address the concerns of patients who have skin cancer related issues. So there are plenty of practices that are open and visibly seeing patients. But if you live in an underserved area, if you yourself have medical conditions that put you at risk for going to a dermatologist, there are alternate options. We offer in our office and for our patients a test called Dermtech PLA that I spoke of briefly in the talk. And this is a test that can be sent to your home, administered in the safety and comfort of your home with guidance from your dermatologist. And the test can very accurately rule in or rule out the possibility of melanoma. There are other types of skin cancer that we briefly touched upon that this test will not pick up, but thankfully those are generally much more indolent and they're much slower growing. And so the most important thing is to make sure that a lesion is not suspicious for melanoma. So most likely your doctor would ask you to send a picture. And if the lesion looks at all suspicious for a possible melanoma, they would either ask you to come into their office, or they may be able to send you this at-home assay that can better assess whether the lesion may need a biopsy. So the bottom line is, do not wait, reach out, it's so important.
Okay, the third question we received, what should I do to help lessen my chance of getting melanoma? So Of course, we can't go back in time, but for those of you that do have children, we want to try to educate them while they're young. We want to try to minimize the chance of getting sunburns. We, of course, want to keep during youth, adolescence, and exposure to tanning beds at an early age directly increase one's chance for getting melanoma. But if you yourself have already had exposures, the most important thing is to be good going forward. Because if you remember during my talk, I did mention that contrary to popular belief, only about 25% of your lifetime damage occurs by adulthood. And it really is an ongoing process. So it's not too late to protect yourselves. First and foremost, you want to avoid a sunburn, because all sun exposure that's unprotected can lead to the development of skin cancers. But sunburns specifically, that intense burst of sun that you get from a sunburn or from a tanning bed, directly increases the chance of getting melanoma, which is the most serious. So definitely avoid sunburns and tanning beds. Also, you want to get in the habit of wearing sun protective clothing, staying in the shade when possible, keeping your hat and sunglasses on. And as we mentioned, you want to use a broad spectrum SPF of at least 30 or higher. So those will be the main things to do. But again, even if you weren't good when you were younger, it is not too late. You can employ these sun protective behaviors now. And most importantly, familiarize yourself with your own moles, because if you notice something changing or something that looks new and suspicious, the sooner you can get into your dermatologist to have that biopsied and evaluated, the better that the prognosis will be.
All right, the next question. We've talked a lot about the importance of an annual, or very often more than once annual, full skin examination. And many of you hopefully have already had that by a dermatologist. What about for those of you who have never had that? What can you expect? What is it like? What questions should you prepare? What questions should you be prepared to answer? First of all, I should point out that a complete skin examination is exactly that. It is a very, very thorough head-to-toe examination. We check every nook and cranny. We look in, of course, the sun-exposed areas, but we also look in the areas that the sun never shines. Because although the majority of melanoma and skin cancer, there is a small rate without. Make sure that your fingers and toes are exposed, the toenails, so that the nails can be examined, as although it's uncommon, you can get melanoma or other skin cancers of the nail unit. And if you have an opaque or dark colored nail polish, it will be impossible for your dermatologist to detect it. So you want to come in, no nail polish, and be prepared to be looked at head to toe. Questions that you will be asked by your dermatologist include prior sun exposure history. Have you had any blistering sunburns, either remotely or more recently? Do you regularly wear sunscreen? Have you ever used tanning salons? Whether your family or yourself has a personal history of skin cancer, particularly of melanoma. And based on these, they will have a discussion with you about your risk relative to the basic population for melanoma and for other skin cancers. Questions that you might ask will pertain to what type of sunscreen you might use, what's a good one that might be good for your specific skin type, what SPF number to look for, and hopefully all of this will be covered. Make sure that when you do come, if there are any spots that you've noticed that are new or otherwise concerning because they've been changing or otherwise fit the ABCDEs of melanoma that we talked about, that you bring them to attention and highlight them.
Okay, the next question we received: what are some common melanoma or sun safety myths that we should be aware of? There are so many out there. Probably the thing I hear most commonly still in practice is that you don't need sunscreen on a cloudy day. So oftentimes a patient will come in with a significant sunburn and I'll say, were you not wearing sunscreen? What happened? And they'll say, oh, it was cloudy out. I didn't think I needed sunscreen. So we remind our patients that ultraviolet rays, specifically ultraviolet A rays, can penetrate through clouds, but also remember the weather can change. So even though it might be cloudy in the morning, Certainly it's reasonable that within a few hours, the strong sun's going to come out and those ultraviolet B rays are penetrating through as well. So this is why we like to get people in the habit of wearing a broad spectrum sunscreen with UVA and UVB protection every single day. One of the other myths I hear, which I've addressed previously in this talk, is, oh, the damage is already done. So many times a patient will come into me and they'll still be really tan, and I can tell they're still sunning themselves without protection. And I'll say, you know, are you remembering to wear your sunscreen? And they'll say, oh, I figure, you know, the damage is already done and you'll just take care of it. And I try to educate patients that this is not true. As we've talked about, sun damage is an ongoing process, and wearing sunscreen every single day and practicing other sun protective behaviors can diminish your future chances of developing skin cancer and also slow down the signs of premature skin aging. And I guess the last myth, there are so many myths that we hear, but that I need sunscreen to get my vitamin D. And, excuse me, that I need sun exposure, so I shouldn't wear sunscreen, so I can get my adequate levels of vitamin D. And we try to educate patients that yes, it's true that some of the vitamin D that we have in our body is from conversion of a hormone that we do get from sun exposure. But in reality, most of the vitamin D we can get is through a healthy diet, which may include supplements. It may include vitamin D fortified foods. And these are much better ways to get our vitamin D than unprotected sun exposure. So while we agree that vitamin D is a very important vitamin for overall health, for bone health, to prevent the occurrence of certain types of cancers, it's a very important vitamin, but it is much safer to get it through your diet and perhaps talk to your internist about a supplement, because that's much safer than unprotected sun exposure.
Next question. Yes, we hear those myths all the time. Okay, the next question pertains to what does a visit look like during COVID-19? Are we doing virtual visits? Is it using telemedicine? And how does it differ from a regular visit? So typically, we, like many busy dermatology practices, are in the office, 5 days a week, seeing patients all day long. And due to, restrictions about what type of patients we can see, how many we can see, and the need for social distancing, that simply is not a realistic possibility right now. So we have limited our days and our hours in the office, as well as the number of patients that we can accommodate. But that should not be an excuse for, again, not seeking medical attention if you are concerned about something. So our virtual visits, which we are offering in addition to in-person visits, usually will begin with a photograph that is submitted. So we ask the patient to photograph the lesion of concern and send it to us in good lighting, multiple views, often with a ruler adjacent so that we can get a sense of the size and also get its relationship to surrounding lesions. Then we'll have a conversation with the patient, often on FaceTime or just on a telephone, to discuss the lesion of concern and what next steps may be appropriate. But again, if we are concerned that something may be a melanoma, we might then send the pigmented lesion assay to the patient's home, or better yet, have the patient come into the office for a appropriate examination.
So we have a few more minutes. We've received a couple more questions. One question was, if a mole fades in color, like my freckles, as I get older, is this normal? So this is a somewhat complicated question, and it's a good one. We do know that during childhood and during young adulthood, we continue to get more moles, and certainly the number of moles and freckles that we have is correlated with sun exposure. However, after about age 40, it's thought that we don't typically get the same number of new moles. In fact, some moles even start to lighten or fade or even go away. Of course, that's assuming that you've gotten better about sun protection, because if you're still getting a lot of sun, you may continue to notice new moles and freckles. So while it is common and normal and expected that after about age 40, you might start to notice less moles, it's also important to realize that if you have a very dark mole that starts to change colors, which may include white actually. So if you're noticing white, the color white occurring within a mole, that is not necessarily a good sign that this mole is fading. It actually could be a sign of something called regression, which is a rare but important phenomenon. melanoma, we've learned more and more, is an immune-regulated cancer. So this is why in the past, some typical chemotherapy agents didn't work as well as the newer immunotherapy agents. Because it's very immune-regulated, our body can start to mount immune response to certain moles if they are cancerous or becoming cancerous. Sometimes over time, those areas of fade, practicing the colors blue, black, these are colors that might actually indicate that a lesion is becoming melanoma and it should be evaluated. And just one thing I do tell my patients is that a good thing about aging is at the same time to develop benign age spots and other types of spots. So all the more reason to familiarize yourself with your moles and to make sure you see a board certified dermatologist every year for a complete skin examination.
And I think we have time for one more question. Someone inquired, is it true that you can get a sunburn through a car glass window or through a glass window of any sort? And this is a very good question. Just a brief overview. If we were to break down the type of ultraviolet radiation that comes from the sun, there are two major types: ultraviolet A, which is the longer wavelength, and ultraviolet B, which are the shorter wavelength. There is a third type called ultraviolet C, but those rarely reach the Earth's surface, so I'm not going to talk about those. So between A, the long wavelength, and B, the short wavelength, UVA is far more prevalent. They comprise the vast majority of rays at the sun's surface because they do penetrate more efficiently through the atmosphere. They therefore penetrate through clouds and through glass. We typically think of these UVA as being implicated in skin cancer, but unlike the short rays UVB, which don't penetrate as efficiently through clouds and therefore also through glass, they don't cause an acute sunburn. That does not mean that they don't wreak havoc on the skin. They cause pigmentation, cause blotchiness. They definitely contribute to a common condition called melasma, characterized by brown spots on the face. They do cause skin cancer. They are the rays that cause suntan more than sunburn, but it's classically UVB that causes sunburn. So can you get sun damage? Can you get skin cancer? Can you get photoaging through glass windows? Absolutely. Can you get a sunburn? A little bit perhaps, but not as much as you're going to get the silent dangers of UV radiation. So you do want to protect yourself in your inside glass, even though you won't get a bad sunburn.
Okay, so that wraps it up. Thank you so much for your attention. May is Melanoma Awareness Month and Skin Cancer Awareness Month, so we're so glad that you tuned in. We hope you have a nice sun-protected Memorial Day weekend. And if you do have any follow-up questions, you can continue to post those on the Facebook page of the Melanoma Research Foundation, and hopefully you'll receive answers to those questions. So have a healthy and sun-safe weekend and summer, and we thank you again for your attention.
Take care. Have a nice holiday weekend. Be safe.